St. Francis Orthopedic Trauma Fellowship gives you a unique experience where you're a single fellow working with 5 fellowship orthopedic trained surgeons.
We are the largest center between Dallas and St. Louis. It functions as a level 1 trauma center, and that's for both pediatrics and adults.
Our fellowship specifically is unique in that we're able to take care of every field of orthopedics. You know, I think a lot of fellowships that you go into, sometimes things are divided up. We're pretty unique in that we are able to take care of all the injuries, including pediatrics.
Here at St. Francis, we have a complement of residents and advanced practice providers. So currently we have nurse practitioners, myself included, who manage a lot of the preoperative care, perioperative care, postoperative care to allow the physicians and the fellow to focus on operating, doing the challenging cases, helping out with care, but we'll take care of the things on the floor.
We have a different system here where the fellows, he's the top of the pecking order. He gets to choose any case he wants, and there's no competition for that. So, you know, unlike Harborview and maybe perhaps some of the other places where you're segregated to a rotation where you'll be on pelvis acetabulum for a few months and then you'll be on a different rotation. When you're here at our program, you pick what you want every day.
The main point is that we have a graduate autonomy. So we know that we can't have just a curriculum that is the same for every fellow because everybody shows up differently prepared.
If they come prepared and they're ready, we let them get going right away, but it's a graduated program where the more experience they get, the more we let them do.
I think there is a large variety of cases that a fellow will see here at St. Francis. I think there's a great complexity and volume. You're going to see anything from pediatric to geriatric. You're going to see high energy polytraumas to cold traumas, such as non-union and malunion, and then you're also going to see some complex arthroplasty as well.
One of the best things about this fellowship is how the day you leave here, you're a totally different person and a different surgeon than you were when you started here.
One of the biggest things that a fellow will gain is how to sort of get the job done with minimal hands.
I think there's 3 areas where we really see the fellows have growth throughout the year. The first area is obviously the clinical and surgical aspect with that. We see major growth in their skills within the OR, but also in their surgical planning. There's also the academic growth with it. Their ability to teach others around, I think, is a major area. And then their professional growth as well. Their ability to communicate, to lead, and to be resilient. I think we see all those areas of improvement.
You're going to be guaranteed to be a competent, well-trained surgeon that's ready to tackle almost every problem that you'll see in your first job. You'll be confident, you'll have the skill set, and you'll be ready to go day one to tackle all the things that you never thought you would be able to tackle.
And so the fellow is operating 4 to 6 days a week, depending on what the call schedule is. And that really gives him or her a chance to get in there and roll up their sleeves and learn how to be an orthopedic trauma surgeon.